Good evening and welcome to Montgomery Heart and Wellness. I have been away for a while. However, I came across this interesting article that talked about post-vaccination syndrome. There's a new vaccine illness reported by the group at Yale. And I thought it'd be interesting to discuss this, however, because in my practice, I see lots of individuals who have lots of clinical illnesses that are related to having been vaccinated. And I thought it was interesting that this group did this analysis. So essentially, I'm going to share this study with you, and I'll talk about the basic findings and the limitations. Essentially, a descriptive analysis reported symptoms of patients experiencing after COVID-19 immunization. So let's just take a look at the findings. I'll cut to the chase, go over the findings, describe what the findings mean, and give you my take on the broader discussion that needs to be had on the COVID vaccine. So the abstract showed that they studied 241 individuals. They were adults, aged 18 and over, and they self-reported post-vaccine syndrome. Essentially, the median age was 46. So this was a young, relatively healthy population. Most were female, 80%. 87% were non-Hispanic whites. Most of them received the Pfizer vaccine, about 55%. Another 37% received the Moderna vaccine. The onset of symptoms averaged about almost 600 days. So this is almost 2 years after the vaccine where they had the onset of symptoms. These symptoms were essentially exercise intolerance, fatigue, numbness, brain fog, neuropathy, and they also had some psychological conditions reported shortly before doing the survey, feeling unease, fearfulness, overwhelming sense of worries, helplessness, depression, hopelessness, and the like. They had low health status after the symptoms. They had a high symptom burden and high psychosocial stress despite having multiple treatments. So in essence, there's not much else to go to this. It's a self-reported study. That's a limitation. The other limitation is that this study is not a control study. You like to do control studies where you have a group that receives the vaccine and a group that doesn't, and you compare those groups. This is not. The fact that it was self-reported also creates some kind of a selection bias. So there are many limitations of this study. Also, there weren't biochemical analyses done. So one can argue that due to the limitations, it gives us a very small amount of information. However, the fact that these patients were relatively healthy is important to note. That's one. Two, the fact that they had systemic illnesses, brain fog, fatigue, exercise intolerance, and they were within 2 years. These were real physical abnormalities and real physical findings that created a change in their overall lifestyle and a change in their overall health. And this is also important to know that this was a healthy population. So why are those things important? We know that the vaccine was intended to save lives, so that's one thing. The original studies, if you look at the original studies with Pfizer and Moderna, the New England Journal articles did not show any difference in survival in the original population of relatively healthy individuals. So in those populations, the median age around 50, early 50s, so very similar to this population. So what we know about the vaccine based on the original data in Pfizer is that these individuals did not benefit from life-saving effects of the vaccine. The question is, in older, sicker patients, did they have a benefit? And we don't know that because there are no controlled studies looking at an older, sicker population. It's speculated that they did. Some people quote data here and there, but there were no controlled studies looking at older individuals. And so, in essence, what you're dealing with is you're dealing with a situation where we had over 70% of the population vaccinated. We're looking at conditions now, and I'll do videos on this later. We have an increased amount of people with the flu this year. In fact, we're in the middle of a flu pandemic, and we'll talk about that in another video. There was an increase in overall death among individuals 18 and 64. And this is data from the life insurance data. So we know that there's, after vaccine, there were increased adverse events. We cannot attribute these to the vaccine. However, the fact we have this study showing that there's an association with this post-vaccination syndrome implies that more work needs to be done. I wish they would have data, for instance, on the spike protein titers and correlate that with the symptoms. However, we don't have this data. But all in all, I thought it was a very interesting study because it's important for us to start to ask questions about what we're dealing with, because certainly in my practice, and I know in other practices, we're seeing a lot of individuals coming back with heart disease, systemic illnesses, and various things that we're having to manage. We, in our practice, get a detailed history as to whether they have a history of autoimmune disease or a history of post-vaccination. These are individuals with new onset valvular disease that occurred only after being vaccinated, etc. So even though the pandemic is over, the vaccine is still being recommended, and I think it's time for us to take a close look at individuals who are reporting symptoms. We can start to do retrospective analyses in a similar fashion that this was done. However, you may need to do controlled studies to get individuals who were vaccinated and see what their overall clinical outcome versus individuals who were never vaccinated. Now, there's also controversial what's the definition of vaccinated versus unvaccinated. In my opinion, vaccinated means you receive both of the shots with Pfizer, Moderna, and unvaccinated means you've never received a single shot. And so we need to look at this population and start to get more detailed answers because it's going to affect our ability to care for individuals who are presenting in the clinical setting with chronic illnesses, increased stroke, increased embolization, despite being on adequate therapies for these conditions. So I thought this was a very interesting study. Let me know what you think in the comments, and if you have any questions about these findings, about this discussion, please leave your comments and questions in the comment section, because I think it's really important that we start to raise questions and look into this. I, as a clinician and scientist, will start to certainly analyze my patients so that I can provide the best care for them. So until next time, I hope you do well and take care. Until the next video, look forward to seeing you then.